Have you ever heard that retinol thins the skin, or that if it's not peeling, it's not working? Today, I'm busting the 5 biggest myths around retinol so that you can finally start to get the results that you want, because when used the right way, retinol is the GOAT of anti-aging, the greatest of all time. And when it's used the wrong way, it is your skin's worst nightmare. Okay, so let's use it the right way so you can get the results that you want. Hi there, I'm Dr. Hamidi. I am a board certified dermatologist. I have 15 years of experience treating people with retinoids, including retinol, tretinoin, all of the above, prescriptions, over the counters, you name it. And lately there have been a lot of myths traveling around the internet around retinol and retinoids in general that either have people using it the wrong way or just have them completely avoiding it, which in my mind is doing people a huge disservice. So let's get to debunking those myths. So the first myth is that retinol thins your skin. Is this true? The obvious truth, because I'm here saying it's a myth, is that it is not. What retinol does is actually the opposite. It actually helps your skin, that second layer of skin, the dermis, where the collagen lives. It helps boost collagen growth. So in fact, it is actually thickening your skin, and that is why it is the go-to of anti-aging, because it does that so well, and it has been proven to do that over and over and over again in multiple clinical studies. So in fact, it is actually thickening your skin. What I think people are inadvertently referring to and worried about is the fact that retinol also acts sort of like an exfoliant. It doesn't truly exfoliate the way that traditional exfoliants do, where they make the skin cells less sticky, and so they're sloughing off the top layer of skin, that dead layer of skin. So it's not exfoliating in that way, but it is increasing the rate of your skin cell turnover. Your skin is an organ, it is a living, breathing thing, and it is constantly changing. And so in your epidermal layer of skin, that top layer, your skin cells are continuously renewing and regenerating, and the cells in the bottom layer of your skin are continuously dividing and moving up to the top layer. And when they get to that top layer, they become this dead top layer called the stratum corneum. That dead top layer is responsible for a lot of the dullness that we see and irregular texture and roughness, etc. As we age, especially in our 40s, 50s, and beyond, that rate of cell turnover really decreases, and so we get a lot of buildup of that top layer of skin, and that's why we see a lot more dullness and dryness, etc., in our older age. But retinoids help regulate that and normalize it. And so they help the cells cycle through that cell cycle, that epidermal cell cycle, and get rid of that top dead layer more efficiently. And so that is why they are in a way exfoliating the top layer of skin. If you consider that thinning the skin, which I don't, then sure, maybe it thins the skin. But really, in essence, it is doing you so many favors. It is helping you build that collagen that you are desperately trying to hold on to, especially when you're perimenopause, postmenopause, and your estrogen levels are declining, and your collagen production levels are also declining in response to that. So really, again, retinoids in general are the GOAT of anti-aging. Myth number 2 is that stronger is always better. And I have mixed feelings about this myth, because it is not always better, and whenever we're talking in absolutes, 99% of the time it's not going to be true. So always is a strong word, and I would say that yes, a more potent retinoid, including retinol, that's a higher dose than a lower dose retinol, is typically going to give you a better result when it comes to that softness, that smoothness, that improved texture, and even improvement of some of those fine lines. Now, does that mean that you should always go for stronger? The answer is no, because this is highly dependent on your skin type and what other products that you're using along with it. Because if you are someone with sensitive skin, using a higher dose retinol, especially right off the bat, is just going to wreck your skin, and you are not going to like that, because as wonderful as retinol is, we love it so much for all its beautiful anti-aging effects, it also has these potential side effects that are very limiting, and it limits how people can use it, how often they can use it, how strong of a dose they can use. So those side effects are dryness and irritation, and making your skin a bit more sensitive to other products that you put on it. For example, I will have people sometimes that start a new retinol, etc., and after a few weeks they notice that their moisturizer, their regular bland moisturizer that they've always used, all of a sudden starts to sting when they put it on, and they think it's a problem with the moisturizer, that the moisturizer is causing issues. but really it's not the moisturizer. It is the retinol making their skin more sensitive to the moisturizer. So yes, that is a definite potential side effect. Dryness is one as well. Peeling, because part of that peeling might be just from dryness, and just effectively hydrating and layering the retinol in the right way can help with that. But the other possibility is that it's just peeling because it is getting rid of that top layer of skin like we just talked about more efficiently. And so that can definitely be a temporary thing. Whether you're hydrating or not, it might not go away, at least temporarily. Over time, usually after the course of 2 or 3 weeks, it typically does go away if it's really just from an exfoliating effect. The key to that is you need to be using it consistently, probably every single night. Sometimes people do it every other night and the peeling just continues and continues and continues because it is never fully exfoliating that top layer. It's kind of renewing that top layer and then exfoliating, renewing, exfoliating. And so you're never really getting rid of that peeling. Okay, so yeah, stronger can work better, but it is all dependent on your skin type, the other products you're using with it. So my general advice to my patients and clients typically is, if you are retinoid naive, meaning you have not ever used a retinoid, including retinol, in your life, or if you have, but it's been a really long time, then you kind of want to ease into it. You want to start with something that's a little bit of a lower dose. And depending again on your skin type, you might go super duper low, or you might start sort of in the low to moderate range, which would be somewhere in the 0.2 to 0.5% range of retinol. And kind of let your skin ease into it, work it up slowly. And then if you finish that bottle and you're doing fine and you're using it every single night, then yeah, then you can go up to the next dose. And I definitely see that in both my patients, my clients, and myself. Yes, the stronger retinoids, like the prescription ones, do work faster for sure. They definitely get you where you want to be faster, and sometimes they do a bit more effectively as well. So again, work it up as you can, but do it carefully, slowly, and always being conscious of what your underlying skin type is and what your skin can handle. Okay, the third myth is that you cannot use retinol around the eyes. Again, this is one of those places where there's a caveat, right? Yes, you definitely can use retinol around the eyes. Do you need to be more careful? Absolutely. I would definitely not go right off the bat with like a 1% retinol around the eyes every night. You're really, really going to hate yourself if you do that, because your eyes are going to be, they're going to be swollen, they're going to be red, they're going to be itchy, they're going to be dry, and you are going to be really unhappy. So what you would want to do is, again, start with a even more conservative, lower dose of retinol. And think about it this way: a pea-size amount, a pea-size, regular pea size, not a jumbo pea, is enough for your entire face. So think about how much you actually need for around the eyes. It's like a pin drop almost size, right? So maybe a little bit more than that, maybe a few pin drops, but a tiny, tiny bit goes a long way. So if you're going to use retinol around the eyelids, very, very tiny amounts, be very sparse with it. Dab it around. I would really just do it on the lower eyelids, because the upper eyelids are actually even more sensitive than the lower eyelids. So you really want to avoid that area, in my opinion, and just go with the lower eyelids and dab it on there, tap it in until it's absorbed, and always, always, always follow it up with a nice thick moisturizer around that area, because that thin, delicate, sensitive eyelid skin will dry out and will get irritated much more easily than the surrounding skin. Okay, so hydrating, moisturizing really well is super key in this instance. And then the other thing you want to do with retinoids in general, but especially around the eyes, is start them slowly. So not every single night, typically every other night, no more than that to start. And then yeah, eventually you want to work it up to every night if you can. And so that is the lowdown on retinol use around the eyes. You just have to be very careful. The fourth myth, which I hear a lot in my clinic, again, to no fault of my patients, because this is what they're hearing online, is that you can't use retinoids if you're out in the sun at all. So is this true? Is it not? Again, there is some nuance here, okay? This is something that's lost a lot of times in the social media world and the 60-second soundbite world. There's nuance here. Yes, you may use retinoids, including these really, really strong prescription retinoids that I prescribe in my clinic for treating acne, etc. Yes, you can still use them. Do you need to be more careful with the sun? Yes. Does that mean you can't leave your house? No. Does that mean if you play sports, you can't use retinoids? No. Outdoor sports, you still can. You just have to be conscious of how you are protecting your skin. So, number one, they do make you a little bit more sensitive to sun burning. The reason for that is because of that sort of exfoliating effect that it's having. That top dead layer of skin, because it is being exfoliated in a way, just like any other exfoliant, like the hydroxy acids, etc., also have the same effect. They are allowing the UV rays in a little bit more easily. And so, yeah, you'll be prone to sunburn a bit more easily if you're not properly protecting. So if you're using a retinoid, my recommendation is, it's pretty much what I recommend to everybody, but I think it's much more important that you follow these recommendations when you are using a retinoid, especially if it's a stronger one, which is that you wear sunscreen, preferably a mineral-based sunscreen, because remember how I said that retinoids make your skin more sensitive to other products that you put on them? Well, that goes for the sunscreens as well. And by and large, chemical-based sunscreens that have the chemical sunscreen ingredients in them, like avobenzone, oxybenzone, octinoxate, those kinds of things, there's a ton of them, do irritate the skin more easily than the mineral sunscreen ingredients, which in the United States are just two. They are zinc oxide and titanium dioxide. So if you are using a purely mineral sunscreen, you are minimizing the risk of that irritation. And you're also protecting your skin really, really well. So you make sure you put that sunscreen on, make sure you put a nice thick layer on like you're supposed to, and make sure you are reapplying, because if you don't, yeah, for sure you are more prone to sunburning. And when you are able, put on that hat, especially a wide brimmed hat, helps protect your sides of your face. So it's all about just being careful, being smart about it, and not using, like a high dose prescription retinoid on your face, going out and playing volleyball for 2 hours. And I live by the beach, so we have a lot of volleyball players out here, going out and playing volleyball for 2-3 hours without sunscreen, or with just a very thin layer of an SPF 30 chemical-based sunscreen that you don't even reapply. So yeah, you might sunburn in that situation. Okay, so you may use it, just be smart about it. Myth number 5 is that you shouldn't use retinol every single night. I can't tell you how much this myth bothers me. This should actually be number 1. I should have talked about this first, because when people say that they are really standing in the way of your getting the results that you want and deserve from your retinol. Okay, so retinol really should be used every single night if you want to get the most out of it. Can you use it every other night? Yes, you may, of course, and you will still get some benefit. You won't get as much benefit as if you were to use it every single night. So why do people even say that, to use it every other night? The main underlying reason for that is they are kind of warning against the potential downsides, right? Like the irritation, dryness, etc., that can come from it, and thinking that using it every other night will help prevent that and minimize that. And yeah, it may, for sure, but you're trading off efficacy for that. Okay, so here's my recommendation. Find a retinol that you can tolerate every night, and that you don't have to spread out so much, and that you don't have to stop, for 3 days every 5 days that you use it, because you're just never going to get the full effect. And so if that means using a lower dose retinol, go for it. Okay, so my recommendation is always go for the highest dose that you can tolerate on a nightly basis. And again, this is going to be dependent for you on a number of factors. And it's not just your skin type. Yes, your skin type matters. If you're more sensitive, you're not going to be able to tolerate a higher dose. However, it's also dependent on your other products in your skin. This is why getting help from a professional is so important when you are planning your routine. And unless you want to just throw spaghetti at the wall and see what sticks. But it just does depend on what else you're using in your routine. And this is a case-by-case basis. So if you're also using exfoliators, depending on which ones, and again, in combination with your skin type, and then what are you actually using to support your skin? Otherwise, your moisturizer, are you using a hydrating serum? Are you using a peptide that's going to help hydrate? Are you going to use a barrier repair cream at night because that's going to help prevent the, irritation and dryness, etc.? So all of that comes into play. Also things like, what is your current climate and how are you supporting your skin internally? Are you supporting your barrier and minimizing that chronic low level inflammation in the skin with a healthy lifestyle, all of that actually factors in, believe it or not. So yes, use the retinol that is going to work with your skin every single night, and you will get the most benefit out of it. And on that note, I have a bonus myth to give you. Myth number 6, which is that retinol should be used over moisturizer. So this is just not true. I mean, can you use it over a moisturizer? Yes, you may, especially when you're kind of starting out and you're wanting to get your skin used to it and really ease into it. For sure, you can use a moisturizer first, put your retinol on top. There's also the sandwich method that people talk about, moisturizer, retinol, moisturizer, and that really makes it more tolerable, but you are going to be losing some efficacy there. So over time, you want to transition to a place where you are using your retinol underneath your moisturizer. And if you do that, you will see a noticeable change in the effect of the retinol and how well it's working for you. You're going to feel your skin is softer. You're going to feel your skin is smoother because it is getting that exfoliating action down a little bit better versus layering it over a moisturizer. Okay, so that is your bonus myth. I hope this video was helpful because, again, when you are using retinol the right way, you are going to get so much benefit out of it, not just in the short term, but also very importantly in the long term. We got to have the long game in mind here, because if you are looking at your skin 5 years, 10 years down the line, what do you want that to look like? And what actions do you need to take today to cultivate that future you, that future skin, right? And retinoids in general, retinol as well in that category, are one of the most effective products that you could be using to cultivate that future skin that you love. So I do not want anyone to be steered away from using retinol or retinoids in general because of what they're hearing online. You really, when you do it the right way, especially with some expert guidance, you are going to get so much out of it. And yes, I am on my soapbox when it comes to retinoids. I will die on that hill. It is the GOAT of anti-aging, topical anti-aging at home. You will not do any better, not with your red light, not with your estrogen, not with your peptides, none of that. So if you can use it, use it. So if you have any questions about that, pop them in the comments. If you are not subscribed already, please do. And if you like this video, go ahead and hit that like button so that YouTube will show it to more people. And if there are any other topics you want to hear about, let me know in the comments because I want to know what you guys want to hear about. Okay, that is it for now. I hope you have a wonderful day and we'll talk next time.